Hello, I'm Steve Farmer, an Associate Professor of Medicine and of Health Policy and Management at George Washington University in Washington, D.C. Thank you for the opportunity to comment on my manuscript titled Patient, Caregiver, and Physician Work in Heart Failure Disease Management, a qualitative study of issues that undermine wellness. I'm thrilled that my manuscript will be featured in an upcoming issue of Mayo Clinic Proceedings. The project was a mixed method study of factors that lead to hospitalizations of patients with heart failure and was performed at the Northwestern Memorial Hospital in Chicago. We conducted chart reviews of all heart failure patients over a 3-month period, along with interviews of clinicians, heart failure patients, and their caregivers. Clinicians represented primary care, emergency medicine, hospital medicine, and cardiology, and also included social workers, nursing staff, and advanced practice providers. The interview data were analyzed using state-of-the-art qualitative methods. The main finding of the study was, of course, that patient adherence with a plan of care, including medication, diet, self-monitoring, and follow-up, is the most important factor driving hospitalization. What was unexpected were some of the complex and multifactorial reasons for the poor adherence to the plan of care. Many patients reported that the plan of care was hard work and that they were less likely to follow the plan if they lacked insight into the severity of their heart failure and the reasoning behind each of the elements of the plan. A lack of trust in healthcare providers was an unexpected theme and reflected a multitude of transient medical contacts across a fragmented system, conflicting messages between providers, and frequent medication changes. Ominously, the great expense associated with medical care also contributed to distrust. Clinicians, in turn, talked about insufficient communication between providers and the limitations of electronic medical records as a communication tool. They described inconsistent insurance rules and limited resources to support some of their patients in the outpatient setting. But they also perceived that substance abuse, depression, anxiety, cognitive impairment, and socioeconomic factors often contributed to hospitalization. In October of 2012, the Center for Medicare and Medicaid Services introduced the Hospital Readmission Reduction Program, or HRRP, in the attempt to decrease the unfortunately high rate of readmissions in the 30 days following heart failure hospitalization. The program is largely based on the premise that readmissions to a large extent reflect quality defects that are under the control of providers and hospitals. This study highlights a multitude of reasons behind heart failure hospitalization, some of which may in fact be addressed by physicians in hospitals, but it also highlights that many factors are well outside the control of medical providers. For example, there's evidence that low socioeconomic status predicts hospitalization, and financial factors like secondary insurance, housing quality, and access to transportation and home help may influence adherence. It is hard to imagine that a medical system is legitimately responsible for addressing all of these challenges. This finding relates to clinical practice in a number of ways. Firstly, clinicians need to assure that patients understand the severity of their disease and its prognosis. Clinicians often shy away from explicit discussions about the poor prognosis of heart failure when it's untreated or undertreated for a variety of reasons. It takes time, the discussion is emotionally charged, and often inpatient providers do not have a long-term relationship with the patient. What was clear from the study is that without that context about the importance of their heart failure management, patients are far less likely to adhere with recommended treatments. Secondly, simply providing a plan of care to patients is insufficient. At least in this population, patients described a desire for more help not just in knowing what to do, but in understanding how best to do it. Patients desired more assistance with pragmatic strategies on how to navigate the complexities of heart failure management. A multidisciplinary approach to care may be helpful here, as nutritionists, pharmacists, and social workers are often better equipped to provide that detailed advice that helps patients adhere with care. Thirdly, many of the factors that lead to hospitalization fall outside the traditional role of providers. Successful management of patients outside the hospital will often require engagement of both medical and non-medical resources within the community. The study highlights the importance of patient adherence to effective heart failure management and the need for further work in this area. From a policy standpoint, it provides yet another challenge to the notion that early readmission simply reflects poor quality care. In some instances, it may, but in many instances, hospitalization occurs despite the very best efforts of providers. Studies are needed to carefully monitor emerging payment reforms that adjust payment based on perceived quality to assure that they do not cause unintended consequences.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.